This video will cover step-by-step procedures for completing a dry sterile dressing. Prior to the procedure, please be sure to complete the following steps.
I have all of my equipment that I will need assembled. What I'm going to do is I'm going to place the chucks under the patient's leg to catch any saline or drainage during the dressing change. What I then will do is remove the old dressing, being careful with the tape so as not to rip the patient's skin. If there's any areas that are adhered or stuck, I can use saline in order to moisten that dressing and help loosen it. As I remove the dressing, I will assess for drainage, including color, amount, odor. I will also assess the wound bed itself, which I do have intact sutures, of which there are 6. The suture line is well approximated. There is a very, very small amount of erythema or redness at the site. We'll discard the old dressing. I will remove my gloves, perform hand hygiene. And I'll have my new gloves ready to go. What I will then do is I will open my dressing supplies, being careful to keep them sterile and not reach over as I'm opening up my other supplies. I will then place my clean gloves on. And I'll proceed to cleanse the wound. I will take my saline and I will make sure that I have the patient positioned so that the excess saline can drain onto the chucks. I will go from the area of least contamination to the most. And I will allow that drainage to drain onto the chucks. I will then take one 4x4 gauze dressing, pat the wound, one pass, and I can do that a second time. And I will discard that. Dry off the leg. I will then discard those gloves, perform hand hygiene. Place new clean gloves on, and I'm going to proceed to measure the wound with the wound measuring guide. I'm going to place that where the incision line begins and where it ends, getting an accurate measurement of 6.8 centimeters. The wound is well approximated. There's no open area, there's no depth, so I don't have any length or width to measure, so I just have the length of the wound. What I will do then is proceed to cover the dressing, and I will grasp the outside of my 4x4 place that over the wound. We'll do the same with the second one. Now the wound is covered. What I'll do is I will open up my skin prep. I will place that around the edges where I'm going to be placing the tape. I will allow that to dry. And then I will begin to tape my dressing. And I will do this in the same fashion as the wet to dry, where it will be like a portrait picture frame. So I am covering all open areas. What I will then do, I'm going to remove my gloves, and I am going to reach for my pen, and I'm going to write the date, the time, and my initials. And I will take that piece of tape and place it over tape along the edge so that it is visible. At this point, I will throw away the supplies that I have used. I will perform hand hygiene, and then I will proceed to position the patient for comfort. I will assess the patient again to see if they have any pain or any further needs. I will be sure to raise the side rail to the full position, lower the bed to the lowest position, and I will perform hand hygiene on my way out the door, and I will make sure that I document all of these measures.